Hello, my name's Sarah and I'm from Drive to Build Healthcare, and today I'm going to talk through the hybrid power mattress with you. The hybrid power is a hybrid mattress. It forms as a standard static foam mattress on the bed, but with the addition of a pump unit, it can then become a dynamic therapy surface. This means that you can pre-equip your bed spaces and quickly, easily and efficiently, when required, a dynamic mattress, you can step your patients up. You can also, alternatively, as patients' condition improves, you can then remove the pump unit and step the mattress back down to a static foam surface. The mattress has a maximum patient weight of 254 kilograms, which is 40 stone. The cover itself, as you can see here, it clearly identifies the product. It also clearly identifies the maximum patient weight here. And then at the bottom, you have the cleaning guidance and guidelines set out. And there is also a zip identifier here. The hybrid power zip top cover zip is 360 degrees, which means you can unzip it all the way around. And if there is damage to the top cover only, it's possible to replace that rather than the top and the base of the mattress. The cover inside is a white inner substrate. The reason for this is if there is any damage to the cover on the outside that's not visible to the eye, you can unzip when you're doing your audits and clearly see any staining inside, which will mean that the mattress has been contaminated and it does need to be changed. You can see here as well, the mattress has blue side formers at the side, and they are castellated at the profiling points of the bed. The reason for that is you get your stability with the castellated side former for patients getting in and out of bed, and the castellations do assist the mattress to mould with the platform as you are profiling the bed using the knee break, the backrest, etc. You can see that it's standard foam inside. We do have a heel zone area here, which I'll go through shortly, and at the top side of the mattress there is a pillow area. It's memory foam on the top, but you do have an option to reverse that to visco-elastic foam if that's what you would prefer. Pop that back in. So that's the mattress as a foam. I'm going to just go through now how we then step this up to become a dynamic mattress. So your patient comes into hospital, the risk assessment requires that they need a dynamic mattress, following obviously your local selection guidelines, or you feel that the patient's just not tolerating a standard foam surface. What you need to do is just essentially attach the pump to the end of the bed, plug it in at the wall and attach it to the mattress, and then the mattress will become a dynamic surface. To then step up the mattress and utilise it as a dynamic therapy surface, it's very straightforward. You simply take a pump unit and attach it securely to the foot end of the bed, like so. Make sure the unit's plugged in. I'm plugged in at the wall. And there is also a green button here on the side you need to click to make sure the unit's on. The umbilical cord from when the mattress is in static mode is securely stored here at the base of the bed. So you just simply take that out, pop that back a bit there, and you can see it's just a male to female, female to male port. Very easy to insert. It's a click and a click. You can't go wrong. And then just make sure the umbilical cover is fully covered for infection control purposes. Now that the pump unit is securely attached and switched on and pumping air into the mattress, you can clearly see here with the green light that the mattress is in alternating mode. This means one cell is inflated and the next cell is deflated, and over a 10-minute cycle they will swap, creating pressure relief on 50% of the patient's body surface at any one time. You can also utilise the static function here, and that creates a stable surface. So rather than one cell being inflated and the next deflated at any one time, all the cells will inflate to create a firmer surface if you require that for nursing procedures, care procedures and medical procedures, etc. The static function will revert back to alternating after 20 minutes. However, by pressing the alternating button, you can do that directly after you've finished any care activities that you're carrying out. The pump unit does have a lock function here. Because I've just put it on now, that's not lit, but after 5 minutes of non-activity with the unit, the pump will lock itself, and then you just simply press it then to unlock it later, or lock it if that's what you require. There are a couple of alarm functions to tell you about. There is a low pressure here, and we have a power failure here. Again, very straightforward. Power failure would be, for example, that somebody's unplugged it, or there's been an electrical fault somewhere. And then the low pressure is telling you that the mattress pump unit is not managing to get enough air into the mattress to sufficiently inflate the patient. Again, that could be for a variety of reasons. It could be that the tubing's not corrected properly, maybe a cell has been punctured. So it is important to act when you do see these alarms, because it does mean there's a problem that needs to be resolved. However, you can mute the alarm here while you're investigating, so it's not disturbing the patient. Finally, on the pump unit itself, we do have a selection of comfort settings for the hybrid power mattress. Up to about 85 kilograms of patients, you would want to select them on the lightest. That means there's less air being pumped in, so that the patient isn't experiencing an overfirm surface. If your patient's around 86 to 170 kilograms, you just literally pop up, 2 lights are now lit, and you know that's the pressure in the mattress. Or if your patient is of a heavier body weight, you can then press again, but that is 172 to 254 kilograms, so you're getting quite a firm surface there. We do say clinical judgment is important and to take into account body morphology, so make sure the patient is comfortable and that the surface is supporting them as it should by just checking them once they're on the mattress. So we'll pop it down to medium there. And finally, I just wanted to demonstrate, so you can clearly see when the mattress is in dynamic mode with the pump connected, how the cells inflate and deflate underneath. So as I explained, it is a 1 in 2 cycle dynamic therapy mattress. It is foam in cell, so when you've got the pump attached and it starts to function as a dynamic mattress, you are getting a true dynamic therapy. It's expanding around the foam cell. And you can clearly see here, you've got cell A inflated, cell B deflated, inflated, deflated, and so on up the mattress. So this ensures that the patient is experiencing 50% of their body is getting pressure relief at any one time. And through a 10-minute cycle, those cells will swap and the other 50% of the patient's body will experience pressure relief. We do have the heel zone cells, as I highlighted earlier, which do go right across the mattress, and that again is to just take into account patients' vulnerable heels. When the mattress performs in static mode, there are smaller castellations in this zone as well, so that is compensating for the heels. When you want to go back to it being a static mattress, or you need to perform CPR, so you need to get the air out of the mattress very quickly, it's very straightforward. You just quickly clip out from the pump unit and attach it, and the air will start to deflate out of the mattress there, and it's back to static mode. All you then do is remove the pump unit, tidy the umbilical cord, store it at the bottom, and the mattress is now a foam mattress surface again. That's the low pressure alarm there. I just wanted you to hear that so you were aware of what the alarm sounded like. The low pressure alarm started to sound because I have detached the pump unit from the umbilical cord, so it's telling me there's a lack of air in there. So I'm just going to mute that. So that's the demonstration for today. It's very, very important though that you do refer to the full user manual for the mattress, that you do use any reference guides that you have in your clinical areas, and if you do have any questions, please make sure that you do refer to us, and we're very happy to help at any time. Thank you.